Hi, I want to encourage you to attend to the World Conference on Lung Cancer to be held in the end of January. It's going to be a lot of important information. One of the most attractive for us, like as surgeons, is the plenary session in which one of the multiple trials about immunotherapy for resectable lung cancer is going to be presented. The importance of this is that there's going to be the presentation of surgical and clinical outcomes of neoadjuvant atezolizumab in resectable stage 1B to 3B non-small cell lung cancer. As we know, surgery is still the best strategy for resectable cancer. Although it provides a great opportunity for cure, we know that most of the patients still having a relapse. Most of them will relapse in distant way, and that will be ultimately the cause of death. There are many strategies that have been implemented for improving the overall survival. As we know, systemic treatment with chemotherapy has not been encouraging. That's why we are looking for better systemic options. There are many pilot studies on the use of immunotherapy to provide a better pathological response. As we know now, the major pathological response is a surrogate of overall survival, and that's the primary goal of this trial. As we know, the trial consists on 2 cycles of atezolizumab, and after the 2 cycles, the patients underwent surgery. In the interim analysis that have been presented of this trial, we know that 90% of the patient finally could be operated, and despite the complex of the surgery, only 2 patients had adverse events that lead to the death, none related with the drug. And this is important because we as surgeons, maybe we will be a little bit challenged for these new strategies. We have the previous results of the new STAR trial in which the use of immune therapy was associated with a perception of a more complex procedure. But the truth is that there is no an increase in the adverse events nor mortality or morbidity. So we surgeons must be attentive to the results of this trial, because it's an opportunity to participate of these new strategies. As I mentioned previously, there's going to be maybe a more challenging procedure for us, but in the end, there is no reason to do not operate these patients. So I expect that the results presented in this plenary will be very attractive for us and encourage us to participate in these strategies for our cancer patients.